The data is showing us that patients want to use AI in their healthcare journey, and more doctors are using AI to assist in healthcare diagnosis. However, most doctors are practicing healthcare the old way and losing their patients to healthcare organizations that are using artificial intelligence. Here's what the data is telling us about how patients are using AI now in three simple practical steps you can implement today to add to your workflow that will keep your patients for life. OpenAI just released a report on AI as a healthcare ally, how Americans are navigating the system with ChatGPT. Great report. Go check it out if you haven't seen it. But it gave us some eye-opening results. High level, 40 million Americans are using ChatGPT. That's more than 5% of all ChatGPT messages globally now relate to healthcare. Among the platform's more than 800 million regular users, 1 in 4 submits a healthcare-related prompt each week, with tens of millions doing so daily. Nearly 1.6 million to 1.9 million ChatGPT messages each week focus on health insurance issues. That includes plan comparisons, billing questions, claims, enrollment, and even cost sharing, according to that report. And finally, 7 in 10 health-related conversations on ChatGPT occur outside normal clinic hours. But guess what? It told us a little bit about how you, as a healthcare professional, are using AI tools. It said that 66% of US physicians reported using AI for at least one use case in 2024, up from 38% the prior year. Nearly half of US nurses reported using AI weekly. These are real data points on how everyday patients are using ChatGPT to solve real issues with access and affordability. Some of these, your patients are really hurting. They're looking for help. And guess what? If you're not helping them, they're getting elsewhere. So before we begin, are you ready to figure out how you can use AI and not be a slave to it? We're going to cover 3 things. First, I want you to learn how to embrace technologies like AI. Second, I want to give you 3 ways to help your patients. Plus, if you stay longer, I'll give you 1 bonus to help you in your day-to-day activities as a healthcare professional. And finally, I'm going to give you some tips on why you need to start today. The fix isn't more automation. It's keeping patients engaged with a human in the loop. That's exactly what we built for. As a matter of fact, that human-to-human connection is so important to us here at SynsorMed that we created a new AI tool called Simon. It's about getting patients engaged in their own care while keeping the human in the loop. A reward-based system that gets them taking their meds, checking their blood pressure, and staying active, all in a point system with leaderboards to keep them excited about their healthcare journey. It really keeps the patient and the human in the middle, but uses AI to track everything and encourage patients along the way. Hey, if you want to see it, if it fits your organization, click the link below, check it out, and give us a call if it makes sense.